Hello, everyone. This is Mariah Taylor with Becker's Healthcare. Thank you so much for joining today's webinar, How Erlanger Unlocked 220 plus additional surgeries per month, a playbook for AI-driven surgical growth. Before we begin, I'm going to walk you through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and there will be time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the QA box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you logged into for today's webinar to access that recording. And if at any time you're having issues with the audio or the visuals, try refreshing your browser. But if that doesn't work or you have other questions, feel free to submit those in the QA box. We're here to help. With that, I'm pleased to introduce today's speakers. First, we have Misti Mattox, Vice President of Surgical Services at Erlanger, and Dr. David Attashrew, Chief Clinical and AI Officer at Qventus. Thank you so much, Misti and Dr. Attashrew, for being here today. I'm going to turn the floor over to you to get us started.
All right. Well, thank you, everyone, for coming to join us today. It's a pleasure to be here and have the opportunity to speak with you. So a quick bit of housekeeping. Today, we're just going to quickly spend some time actually talking about Erlanger's journey, some of the things that they have been focusing on and their goals and challenges across the last couple of years at their institution, specifically how Erlanger went about achieving those goals, leveraging AI, and then talking about a bit about what the experience has been for Erlanger working with Qventus. We'll save some time for Q&A. So please drop things into the chat as well during the call if you have any questions. And with that, I'm going to jump in and talk just to give us a quick background on Qventus. So Qventus exists to solve a core premise. Despite having some of the best therapies, clinicians, and equipment in the world, getting quality care in the United States can feel like pushing a rock up a hill. Our staff, our administrators, and patients are having to do extraordinary things just to get ordinary things done every single day. And so Qventus, we bring AI teammates to automate the various care operations and make those tasks easier. So for the last 10 years, Qventus has been one of the leading AI platforms that has delivered ROI for hospitals and health systems. And I think importantly, it helps secure the margins that actually support the missions that we are all in this for. And we've done this across the spectrum, from academics to community hospitals to safety net institutions. I think we're really proud to say that 100% of our clients see us as part of the long-term outcomes and that they would purchase Qventus again. And primarily that's come down to two main reasons is what they tell us. The first has to do with just the ROI that they achieve. And that's around 10x often, breaking even within 2.5 months of going live. And I think the second thing has to do with our partnership approach. We know this isn't just a technology problem. We operate in the trenches with our clients every single day in and day out, to ensure our solutions are optimized to solve their unique problems so they can achieve their strategic goals. With that, I want to give you a quick background on some of Qventus's core solutions. Now, there's a lot more that we do with the AI platform, but out of the box, there are some specific strategic problems that are aligned to the health system's priorities that Qventus directly addresses. And you can think of Qventus as your AI teammate. It's working 24/7 in the background to automate your end-to-end workflows across care settings, from pre-op to surgery, through the inpatient to the post-acute, and in the ambulatory space as well. And we package these teammates with our deep data, ML, workflow integrations, and change management into specific solutions. Our most common solutions today are the ones that I'll just touch on really briefly. And first, I'll talk about our surgery solution that's focused on driving strategic surgical growth. OR capacity, everyone knows, is at a premium, but oftentimes the strategy of how you're trying to grow doesn't directly translate into the care. These teammates deliver an 11x ROI across our customers by intelligently creating the capacity that matters, making it easier for surgeons to find the time that they need, and by giving you access to a dynamic picture of the market to capture more volume. And this is the experience that Misti and I are going to spend most of the time talking about today. And then we have other products as well. Specifically with our peri-op care coordination solution, we improve the pre and post surgical process by giving every PAT member an assistant that helps coordinate outreach, determine risk, capture key documents, and optimize patients post-procedure. That net, what it means is it enhances staff productivity by 50%, reduces 72-hour cancellations by up to 40%, and it drives more patient optimization revenue opportunities. The next one that I think I want to address that I think is critical to Qventus is actually one of the first places that we had started is actually in our inpatient space, and that's with our inpatient capacity solution. It reduces excess days by up to 30%, creates capacity, and equips care teams with the insights required to operate at the top of their license. What our teammates are doing there is actually intelligently automating discharge planning, sequencing ancillary orders, and orchestrating gaps in the care to reduce length of stay, ED boarding times, and in this case, generate millions in savings for the hospital. One of the newest things that we're doing is actually our care gap encoding automation suite. The reality is that nearly 30% of inpatient patients are actually malnourished, and yet 70% of those cases go undiagnosed. Consider that. And health systems and physicians like myself and dietitians have done everything they can to close that gap. You probably yourselves implemented new tools and new workflows and documentation processes, but it's still very manual in nature and a lot of things still get missed. And so what we have built is a care gap assistant that it identifies the patients at risk for malnutrition and proactively services nutritional consults before gaps turn into delays. And we use structured and unstructured data from your EHR and other sources to do that. Now that care gap assistant is now also being applied to other areas like pressure injuries and encephalopathy. But also from there's a coding and documentation assistant that ensures clinically appropriate CC and MCC codes are documented and ensures severity is captured accurately for higher reimbursement. I think this is more than a CDI or scoring tool. We identify the risk early, the interventions are prompted sooner within the EHR, and we ensure that documentation supports the diagnosis. And what we've seen in this space is that partners have a potential to reduce length of stay by 2 days, reduce readmissions by up to 27%. And what they're finding for like a 500-bed hospital is that they're adding about 1.5 million in revenue from reimbursements. That's kind of a quick overview of the solution. From there, Misti, I'll turn it over to you to share a little bit about Erlanger and your specific institution.
Thank you. Thank you so much for having me. This is an exciting opportunity to share some of the successes that we've been able to obtain through our recent partnership with Qventus. Erlanger is a safety net, level 1 trauma, level 3 trauma, pediatric, academic partnership across a very large region of patients populations that we serve. You'll see that we've got 5 adult hospitals, 1 pediatric hospital, several ED admissions, several surgeries that really have added to the complexity of the way that we deliver care to our patients. And so as we continue to expand, grow our service lines, and increase our volumes, it's a little more challenging to do some of the manual work that all of the frontline staff have had to critically think and get through. So it's no surprise that you start reaching out for some technology support, enhanced clinical pathways, enhanced technological pathways. And so we started looking for some solutions to some of our problems, and we've done that through our EMR system as well as this adjunct technology through Qventus. If I was to say that we had unique challenges at Erlanger, I would be lying. I think anybody that's attending this webinar or has been in a position of leadership for surgical areas at all, at any level, I think we've all faced the same thing. We've got ORs that are highly sought after, and some bottlenecks sometimes of how we can release that time and truly backfill it with those cases that otherwise would have either leaked out of the system or potentially even gone unscheduled. So we partnered with Qventus. David, how long has it been? Probably we're about a year and a half in.
Yeah, yep. Yeah.
And like he said, we did see an early ROI with our partnership. We did commit to some pretty aggressive targets, and we were able to achieve those. And so how we did that was the consulting arm that Qventus offers is more than just an AI technology, because you could package this software up with a bow, hand it to us, and let us figure it out. But they didn't do that. There was a lot of boots on the ground, early implementation, where they helped us use the system and maximize the efforts that were put in from our schedulers and our provider offices. And so doing that really helped us achieve what we wanted to achieve early. There was almost no learning gap or learning curve to be able to learn how to use the system, which I think is why we were seeing those early results. The biggest thing I would say is Cuventus helped us create a foundation of trust within our providers. So for years and years and years, their OR block time or their time in the OR is very coveted. They're not going to let it go away. If a case cancels or they're on vacation, they just hope one of their partners uses the time. And if they don't, then it's obviously the institution's problem to fix. They don't really trust to let their time go because if they may need it. One of the, you'll see on the slide there, some of the challenges, obviously not unique to Erlanger's. We had up to 30% of unused block time. And what that means is we can't put anybody else in that time because we've promised it to someone else until they release manually because they're not going to be there, or the system auto releases, which is typically way too late to be able to backfill a truly optimized patient. So some of the things that we saw were the surgeons were saying, I'm holding my time because I have such a complex mix of elective and urgent. Neurosurgery was a great example of that. Highly elective practice with probably I think we were about a 36% add-on rate from urgent, emergent, and ED cases within that group. So we just had these blocked rooms. We called them no drop blocks. They're these rooms that nobody ever touches, and we just squeeze everything into other rooms. The same thing with some of our acute care services and orthopedic trauma. You just don't touch those rooms because you don't know what's going to come in through the ED. Not realizing that with some adjunct technology, you can really look at some patterns, some scheduling patterns that don't lie. You can still have some lower optimizations in a room that is held with no drop while truly maximizing those other rooms. And that's how we were able to truly backfill some of those high acuity cases very quickly by building a level of trust within those surgeons. Cuventus came in, they helped partner with us. They attended steering meetings, physician meetings to say, this is how it works. If you trust us to release your time, then when you need it, if the process works as it's intended, other people have also released their time and you should have no problem getting your add-on outside of your block. And it worked. And we were able to really show them that data that said, look, this is patient X. They would give a real patient that was scheduled into a nudged released time at X date. And it was a real pathway from how they saw this solution work. And so the trust started to build, and then they started being a little more appreciative of the process, and they would start releasing their time.
Yeah.
The biggest thing with that is not just our higher acuity. So we implemented the solution over, we have HOPD that's here attached to the hospital, as well as an elective joint center, our level 1 trauma, and then we've got some endoscopy suites and level 3 trauma down the road. And we were able to use this and truly maximize time for some of those providers that worked at multiple departments. Things that it would take a clinician hours and hours to truly play that Tetris piece and identify where they could work if they needed a last minute add-on. And we were able to do that with dashboards and trending. So I think the unused block time was really our biggest win early on. And then we branched out into how can we really maximize the use of these robots? How can we partner with our EMR and our intuitive dashboards and make it one landing page that makes sense instead of a whole lot of data that you can't do anything with? So we were able to do that. We were able to maximize the utilization of those robots. They're not sitting in the corner while we're doing open cases. And you can do that through some of these platforms that says, these are robot times and we're going to nudge them as such. And that ultimately leads to growing those priority service lines. You truly take the noise, is what I call it, of having to try to find somewhere to put somebody. And then you have your non-employed physicians that seek out Erlanger for their care, and we have a place to put them, and they don't realize all the work that went in to just say yes the first time.
Yeah, that's really helpful, Misti, to understand that those are some of your focus areas. I imagine as you said in the beginning, like any place I've operated in the last 15 years, and certainly at Erlanger, a lot of these challenges are conserved. A lot of people are in this position where we know there's available time. It's just hard to get back and get it back on the schedule. We know that we have these assets that are super critical that we've invested in, and yet it's difficult to make sure that they're always used for the right things and you're not having the wrong types of cases booked on them. And utilization can look pretty good, but the case mix isn't always what we want it to be. We may be growing, but maybe not in the direction that we want to grow. And so it takes more of a surgical approach to actually point our strategy that we've already set and bake it into the day-to-day operations. Misti, could you maybe talk a little bit about what you felt was needed and why, and just talk a little bit about some of the things you had tried in the past and why these options didn't work?
Yeah, absolutely. So I'm very proud of the leadership team that I have across all of my campuses and departments, because they've built relationships with those surgeons. That's a great thing. And sometimes it can also be a barrier, because whereas you can't really look at scheduling patterns and track and trend through a text message, it says, hey, Dr. Tasheru, we noticed that you're not working tomorrow. Are you out of town? Well, that's extremely late in the game to try to backfill. And so working with the schedulers, they'll say, oh, I don't know, you should have talked to my scheduler. I've known about this vacation for 6 months. And so huge breakdown in trying to automate some of those releases, where we found out very quickly that our employed providers, they have some vacation and time off schedules, sometimes set a year in advance. And being able to build that in, knowing that they're really not going to be here, we can be very creative with some of the nudges that we do. So we tried doing the manual, hey, I don't see you on next Monday. Do you want to release that time? Instead of saying, based on the data that we've showed you, you never fill your time on Monday and you're always doing out of block on Thursdays. Do your scheduling patterns warrant a flip room on Thursday, and I'm going to take your block away on Monday? You're not even using it. You're leaving at 10:30. And so some of those things that we tried to do manually for so long were almost eliminated when we partnered with some of the AI technology that Cuventus offers. We also, we used, and we may talk about this a little bit later in the webinar, but we use the decanting support that Cuventus offers to truly say, based on your ASA score, based on your CPT code, based on where this surgeon has privileges, there's no reason why this port or this gallbladder or this hernia is being performed in your level 1 trauma center. You've got time, you've got capacity down in your outpatient center. Let's stop the same day moving and decanting services. Let's look at a roadmap to schedule them in the right place to begin with. And you do all of that through thousands of lines of data that you could not manually review with the best clinician. I mean, I've been looking at OR schedules for 25 years, and I couldn't begin to be able to critically think that far in advance every single minute of every single day.
Yeah. And Misti, I think it's fair to say you have a really good relationship with your EHR, in this case, Epic. And Erlanger has been and continues to be an Epic first environment. You want to fully maximize and leverage their tools. And you've done a lot of that work. Can you maybe speak to like why it made sense in some of these instances to augment the work inside the EHR with the work with Cuventus?
Yeah, absolutely. In fact, Epic was with us through this partnership with Cuventus from the very beginning. It was really just a triad approach. It was not in competition. Cuventus is doing it because Epic can't. We had our Epic liaisons at the elbow the whole time. And so there are some things that Epic focuses on. They're a fantastic partner in the EHR world. There are a lot of dashboards and widgets and things that can help us identify through Block Marketplace, through a lot of other nudges. But what we saw with Cuventus was just an enhanced approach for that, to where instead of looking, for example, instead of looking at the last 10 cases or the last 20 cases, we could look at every case that's ever been done in just a few seconds. And so I think Epic was doing great in that space, and Cuventus was just able to augment and go a little bit deeper with the AI technology that they've been able to bring forth.
Yeah. And you, I remember, Misti, when we were getting going, your institution kind of had an imperative as well for growth. You had made some big investments with anesthesia, and there was a huge push that you had to do more with less, and kind of couldn't afford to accept leakage or unhappy surgeons. Maybe speak to a little bit of the kind of the imperative that you had that drove the urgency.
Absolutely. So again, not unique to Erlanger or probably a lot of institutions across the country. Anesthesia resources are scarce, and being able to truly grow strategically in certain service lines is difficult if you overpromise, underdeliver. You recruit surgeons, you open up ORs, and then you don't have anesthesia for it. Well, Erlanger has had a longstanding partnership with our anesthesia group, and in order to truly position ourselves in this market to where we have anesthesia abundantly when we need it, it came with a pretty big price tag. And so to do that, the imperatives from Erlanger, like you said, was if we are going to commit and we are going to invest to make sure that we position ourselves in this community to have anesthesia when we need it, then we need to make sure that we're filling those ORs. So this was not let's expand our anesthesia and then wait for it to fill up. We are going to expand our anesthesia contract, and we are going to fill these ORs up, and that's what we did. Fortunately, anesthesia has been along the way with all of our Cuventus meetings. They come to all of our steerings and our committees, and they are aligning with Cuventus as part of the strategic plan to be able to optimize these unused or underutilized ORs.
Yeah, that is that makes a ton of sense. And Misti, I love the way that you kind of put it as well. That this was like a collaborative effort. There are things that you had already done to fully leverage your EHR, and then also was thinking, how do you continue the transformation, and what are ways that we can augment that work? Can you maybe speak to, for a second, as you were thinking about this opportunity, you obviously had choice, and you knew what you wanted to achieve. How did you go about making the decision of what you needed in a partnership?
Well, that was very easy. I'll be honest, I don't work for Cuventus, so I can be pretty candid here. Cuventus offers a great product. There's no denying that. But as we evolve with AI technology playing in that space, everybody is being pretty competitive with offering some of the same promises that Cuventus does. What I feel, and my discretion for this partnership, was the consulting arm that Cuventus offers. I was I think David, I think you were in some of the early on discussions. I was very forward in saying, do not drop this solution in my lap and leave after I sign. I want you to teach me how to use it. I want you to optimize the way I'm thinking. I want you to tell me when I'm wrong. I do not want to just have a fancy contract that says now we have implemented AI technology at Erlanger. And Cuventus did that from day one. We had, we're a little over a year into our partnership, and we still have weekly meetings with our frontline team. We still have Cuventus on-site meeting with new surgeons that come on. We have packets for scheduler training as they have turnover in the scheduling office. And so that continuance of, we are here to support you. We know your processes. This is not just a solution that would one size fits all. It was really catered to what Erlanger needs and what Erlanger's vision was.
And I feel like, to be fair, like you were pretty adamant from the beginning that like you weren't forming a partnership or paying for a solution where we're just jumping off of technology. Erlanger was pretty adamant that like we wanted someone who was accountable for outcomes and for the transformation, for seeing it through together with you all.
Yeah. And strangely enough, your sales team that worked so hard to gain this contract built the relationships in the negotiation process. And so I was adamant about having them as part of some of the implementation work. And so Cuventus obliged and gave me people that were not actually supposed to help me implement. They had a totally different job, and I said, no, they sold this product to us. They know what our challenges are, so they need to be part of the implementation. And it was
and I think that's a testament as well to the team that we work with. And I think I'm really proud of that team for building real relationships and wanting to stay on. And there's a lot of shared ownership. People want to see each other. We want to see each other be successful in the deployment. Maybe, Misti, I'll just transition. I think some questions have come in from the audience as well. Just wanting to better understand some of the results that Erlanger achieved, why those results matter, what they specifically were. So could you talk to a little bit about some of these results that you've had with Kubernetes and the impact that those have had for the organization?
Yeah, absolutely. I saw one of the questions in the chat. It may have already scrolled a little bit, but it was cases are one thing, utilization's another. You can make the data say whatever you want it to say. You could say I added 220 cases and not look at you year over year, or you could say I added 220 cases and they're all hernias. You can make the data say what you want to, but utilization is really where you're going to see the outcomes of your investment. And so our OR utilization, some of our areas were really good. And then some, we had really low utilization in like the 30s and 40s. We knew that there were a few little low-hanging fruits that we could do to increase the utilization of some of those ORs. But globally, what we were able to do is decant a lot of our level 1 trauma high acuity volume to our outpatient spaces, maximizing their utilization to in the 70s and 80s. I actually have some service lines that are greater than 100% utilization, and they're in block and out of block that we looked at. Then we were able to strategically focus on how we were going to backfill those high acuity areas, and the traumas always come. The urgent add-ons are always there, and now we're able to take care of them. So the cases are great. It looks good on a slide. It looks good in a headline, but truly the utilization of those rooms is really where you see that your staff are busy, your patients are being seen timely, your length of stay is going down because they're not waiting to come to the OR for hours or days. And that's really those those downstream effects that you'll see on dashboards that you don't actually show in an OR steering. It's more inpatient, ED boarders and things just waiting on a surgical bed.
Yeah. And one of the, as I switch over to the next topic, I think one of the things that's so important is that there is outcomes and impact for our patients that don't show up necessarily in the numbers, but they show up in how it feels to the people that are engaging with the platform. I'd love it if you can just speak a little bit about specifically what you saw on the engagement side, the light that you saw from your surgeon partners, and then kind of the other qualitative side of what the experience has been like for the staff at Erlanger and the others that you work with.
Sure. So obviously you're going to have your surgeon champions and your early adopters that say, I'm going to trust this process until it fails me. And then it didn't fail them, so now they trust the process. I will say that we heavily relied on some of our more vocal surgeons to say, this worked for me. My staff in the office is not having as many roadblocks. It's not having as many screens to click, not having as many phone calls or as many faxes to get the job done. They just click here, say, this is what I want, and it happens. And so the ease of automation for the people that matter to the surgeons is usually their coordinators, their surgery schedulers in the office, and to know that we're supporting every member that helps get a patient scheduled from the time that they see their doctor until the time that they hit the OR table. It's not just OR leadership. It's not just your surgery directors and managers. It truly affects everyone. And so in order to make the surgeons trust that process, they have to know that we're taking care of their teams as well. And we do that. So making sure that they have an opportunity to give us feedback on what works well for them, something that they don't understand, ideas that would make it better. Cuventus has done a good job with us to be able to take little notes of things, take it back to Q Live and bounce it off some other customers. And we've actually implemented some things after we've seen just simple questions from our frontline team.
Yeah, I think it's really helpful for everyone to hear from you, Misti, on kind of what your experience has been at the customer level. And many customers are thinking and asking the same thing of, how does this address the challenges that I have? I've been in a situation where, how do you bring these types of things in? How do you justify it with IT? How do you justify it with the finance? Probably first on their mind, and I think I've seen a few questions come through, is what does it actually look like? What does it actually do? And so we've got Alex Dawson from our team, product team, to kind of walk through and share some of those. And I think Misti, as he's going through and sharing some of the system of action that actually got put to bear, would love, Alex, for you to walk through and show the people online kind of what the technology looks like, to level set, like, only so much we can accomplish in this time. And I think the most important thing is hearing the Misti's perspective. But we'll have Alex show some of those things right now, and then Misti share some of the commentary of how it was used at Erlanger.
Awesome, thank you, David, for the demo. I'm going to go ahead and share my screen, and we'll show a little bit about just some specific features. This isn't going to be the entire solution, but there are specific things that really helped Erlanger in their journey that we wanted to talk about. So you heard her talk about the opening up the available time so that cases can actually be booked in there when things need to be cleared out, when there are blocks that might not be used that are being held open, maybe for a good reason, maybe not. And what Cuventus has is built out a model that actually takes in all of the historical data for a given surgeon and looks at things like known practice days, case types or facility preferences, looks at lead time patterns, what type of, how frequently does this surgeon fill this case or fill this block, ahead of time. And it even takes in Erlanger's specific growth goals, what types of services they want to achieve. And we take all of that in and we do this, we call it, we have two types of outreaches. One is block release, where we, taking in all of that data, we reach out to the surgeon directly with a customized specific email that lets them see exactly what is being asked of them to release that block and what it will do for them. So you see here, like it's addressed to them, and it talks about what kind of impact it will have on their quarterly utilization rate. So they can go in here and right within the email, they can decide what they want to do with this particular email. If they go ahead and hit the release the block nudge, they'll go in and it'll actually email back in to the main OR and allow that block to be released. I'll let Misti kind of talk about that, how how this particular piece has helped with their block release patterns.
Absolutely. So I think there's actually a question in the chat talking about what our normal release times were, and I'm a little embarrassed to say there were certain service lines that didn't have a release, and some of them were 72 hours out. And you all know, if you've ever led an OR, you can't truly optimize a patient. You can fill it with add-ons very easily, but you can't really grow strategically that way. And so the mindset of moving elective block releases to 14 days was not something that we had ever been able to achieve. We talked about it for years, but we've never really gained the trust from the surgeons to say, I can see my patient in the office and I can afford to wait 2 weeks because I'm already so full in my block time that I can do that. So we actually have some service lines that are booking several months out now. And then we have automatic block releases at 14 days for all of our elective procedures. There's a couple service lines that we don't. We will hold them. We've got some sports medicine, some of our oncology, things like that, where they will see them in the office and they need to be able to have some capacity to add them on rather quickly, and we just adjust to that. But for the most part, we have been able to increase the automatic release to 14 business days. And so what you'll see with this email that they get, it gives them the opportunity to say, I see that you're not going to use it. Do you want to give it up? But then that next piece that says, I'm going to increase your utilization to this point, or based on your scheduling patterns, you never use this time. If you will let me have it, if you will let me have this time back, your utilization is going to go up. And they all know, and they all trust our block committee that we assign block based on these metrics that they have to hit. So if somebody is wanting to add a partner or request new time, they're not going to be able to do that if they have low utilization. If their utilization 60, 70, even 75%, we don't even consider them for additional block. And so this is just saying, help me and I'll help you. Click the red or the green. But then it also gives you that option in the middle that says, you know what, let's chat with the team. I don't really want to give it up yet because this is why. This unique patient situation or this unique scheduling opportunity, but maybe you have something that will better fit my needs. And so they have that ability. But for the most part, they will just say, sure, I'm not going to use it. I don't have anything coming in. Go ahead and release my block. And then they can, it's just another foundational layer of trust that's built from the schedulers, the Qventus team, and our surgeons.
Yeah, that's really helpful, Misti. Maybe just one more point on here. Maybe talk to why it matters to be able to do a modeled approach where you're modeling it at the hour level and you're not asking for all the time that the surgeon still has remaining and may not, but just the time that you predict the portion of it that the surgeon's not going to use. And then on the other side, maybe speak to the value of being able to offer these types of incentives and what difference that makes for the surgeon's willingness to release.
Absolutely. So you'll notice on there, it says coming up on this Monday, I just need 2.5 hours. You're not using it. You typically don't use it. I have somebody that wants it. Would you like to just release this portion of your block? What that does is let them know that we're not asking for their entire day. They still have the ability to add on, like maybe they've got some people in their office that they just saw this week that mentally they know they're going to try to add on for next week or whatever. We can already show them. And what we've seen really that helps is when that 7:30 to 10 is kind of flipped in the afternoon, we'll say, hey, can we have your 1:30 to 4 time frame? It doesn't look like you've got anything scheduled. You never do. If I can have it, I've got a patient that we can provide care for if you'll release this time for me. And so being able to have just a couple hours carved out, they're not as scared to release because that's all this is they're scared to release their time that they worked so hard to get and not be able to do a case if they need to. The second part, go ahead.
No, I was just saying every surgeon feels that way. Like we always are.
Yeah, no, you can't have my whole day, but yes, I'll give you a couple hours if you have a patient that needs it. Go ahead. The other piece to that is what's in it for me, because employed or not, if you truly do not have a good governance committee around your block, how you allocate, how you increase or take away, if they don't see what's in it for them, then they're not going to be bought in to making your life easier. It's really, I have to take care of patients. Your responsibility is to take care of everything else. Don't bother me with it. And so you have to really say, you're a very busy surgeon. You continue to use out of block time. You keep asking me to add on these patients after you need your block to go long, or you need a Friday afternoon. You're continuing to use out of block time. I can help you with that. We just need to redesign what your schedule is. You're never using this because you've got a clinic that runs over. And so truly saying what's in it for me help you is how you can engage those surgeons to make everybody's life a little easier.
Yeah, I totally see that. I mean, it's providing a glide path for them to be a good steward, and it makes it really easy on the accountability side. Maybe shifting gears, Alex, let's talk a little bit about kind of the flipped framework of how to fill operating room time. I think for the longest time, the framework has been like, let's just increase transparency. If we increase transparency, we'll see growth. And that way, we're accepting first come, first serve is the way to fill an operating room. But I think we flipped that framework with Erlanger on how we think about filling the operating room and really aligning with taking their strategy and driving that into actually filling the operating room in a strategic way. So you get the right case in the right place at the right time, programmatically, versus hoping that it's going to occur. And so maybe Alex, share a little bit about how the product does that, and we can talk about, Misti, your experience.
Yeah, absolutely. Thanks, David. Yeah, so what David's alluding to is we call it our strategic marketing assistant. And what it does is it's really going out and it's finding, okay, where are available time slots, whether it's a block that was released or whether it's a time slot that's available in open time. We're holding that up against the specific strategic goals of the organization that we're working with. And then we are strategically reaching out to specific surgeons in a customized way with that level of personalization that really helps them feel like they want to book at your system. And we do a similar thing with the emails where we're reaching out and we're saying, and you see here, we've reached out particularly to this scheduler saying that this surgeon specifically is a good candidate to fill these time slots. And we list off both what the times are and the locations. And what this allows them to do is see, okay, there's options here. Like I could be booking into these times, and draws attention to those open times that are sometimes really hard to strategically fill. So what they can do in here is they can click on this link, and it'll take them into our view where you can then actually see those times, make any changes that you need to make to that request within here. You can expand them. You can add any other notes. The scheduler can, say like, hey, this is available. We have a case that we want to book into this slot, and then you can go ahead and actually book right into that time and submit this as a request. And this will go to the OR scheduler, who then can actually book that time. And so by doing that, we're able to increase the volume of cases in a strategic way for that health system. So yeah, I'll turn it back over to David and Misti to talk a little bit about how that reaching out to surgeons proactively has kind of helped drive growth.
And I know like the automation of just a reach out is a pretty easy thing to do inside of an EHR. Misti, maybe we can speak to like, why does the personalization matter? The ability to actually ensure that we are only reaching out just for the times that make sense for that surgeon office, curating it so that it is only the 3 of 100 slots that may be available, and that it's coming at the right time, and that it's also aligned with what your strategic growth goals are. Maybe if you could speak to that level of personalization and why it matters.
Sure. I think this is probably one of the most important things. Is it's very easy to suggest open time to everybody and say, hey, we've got time on Wednesday afternoon, who wants it? Versus this personalized approach to where, why would you send it to these groups, service lines, or doctors when you know they're in the clinic, or they're already operating in another OR across town, like one of our campuses. So by being able to truly target the surgeons that have asked for time before, that are not operating somewhere else, you already know their clinic schedules, we can help align all of that on the back end. Then they're not going to get these notifications all the time. It says, hey, would you like to work on Monday morning? And I'm like, no, I can't work on Monday morning. Stop sending me these. And so then they will just start ignoring the notifications. If they get a notification and it's like, I could actually work during that time, then they're going to pay attention to them and engage more. Otherwise, you're going to see them say somebody else is going to handle that. I'm not going to give it my time because it never works for me anyway. The other piece to that is when you can strategically reach out and you give them the option, they know if they have a conflict of something. Maybe they have a conflict with a rep, or maybe they already have specialty equipment in use somewhere else. And sometimes the surgeons know that they will have some limitations. And so if they ask for it, you have that notes section that says, hey, I'm going to need this vendor. I'm going to need this implant. I'm going to need this specialty table. Let me know if this is available. I want this time. And it still allows the scheduler to say, absolutely, I have no conflicts on my side. I've got you in the depot.
Yeah, that's great. I think, Alex, if we kind of move on to that's the kind of push side. On the pull side, I think all of us are accustomed to the situation where kind of the single point of failure is that clinic scheduler in my office. And the reality is you have to somehow break her or his default pattern, which is I'm going to find the next available block time. I'm going to put the case in that time. But that's not exactly what I want them to do for my patients, not what the operating room wants them to do to actually fill up the white space maximally. And so maybe actually you could show a little bit about how we make it easier to find and book the best fit open OR time versus the first available time in the block.
Absolutely, David. So we do this in a couple different ways. We have a tool, so it takes a second for that to pull up. We have a tool called Time Finder that allows clinic schedulers working for the surgeon directly to interact with Cuventus's rich data and AI scheduling assistance. You see here is we have all the patients available for this particular surgeon. They are able to go between surgeons, at their practice, and filter this patient list down. They can then go into a particular patient, and you see along the top here, it's already filled out the surgeon name, it's filled out the patient name, and we've pulled in the procedure as well, so that we can be able to start this search for additional times. You'll also notice that we pulled in the duration. We actually provide estimation for case length up front, right before they're even booking the case, so that when they do look at the blocks, they can be making an informed decision, and that we're only showing them blocks that they can actually fit that case into. So we'll go ahead and run this search. So what you see here is a couple things. We're showing them a block time where they can book into available block time, and we'll put that up top. We also are recommending open times. Do you see here we have a little bit of prime time availability here in a robotic room, and since this case is able to be done in a robotic fashion, we're promoting that case to the top of the list so that they have the intelligence they need to say, okay, we should book this case into a robotic room at a good time of day. All of that happens within this view. They can then say, well, I might want either one of these depending on what we can actually book. And they'll go in here, and this is where you can then prioritize based off of what your preference would be. So if there are multiple options on a given day, for instance, you can prioritize and say, I want one of these two, and prioritize which one would be your favorite. You can this clinic scheduler can add notes directly to the OR scheduler so that the scheduler can be able to be responsive to whatever the surgeon's requests might be. And then embedded within this is the scheduling form. So this is actually automatically pulling in details from the case and is populating this form, and that's just making it really easy for that surgical scheduler to fill this out, put this request together, and just removes as much friction as possible on the booking process. Once they fill all that out, they can go ahead and submit that case, and it will go over to the OR scheduler. And I'll turn that back over to you, David, and we can talk a little bit about how this helps drive that volume increase as well.
Yeah, maybe actually just one click on this, Misti. Would love to get your perspective on, for Erlanger, like, why does this matter, this approach, versus the default approach of seeing this in a calendar view, or just seeing a kind of a list of times by next available. Why has this kind of approach been helpful for you all?
Well, I would think, I'm not on the scheduling side, but the feedback that I've gotten from our schedulers is the ease of use of them having to search. They're not constantly, got 3 screens open and, well, let me see if that's going to work for you. No, that's not going to work for you. Just the ease of use of the technology for them to say, I've already populated suggestions. I already have the top 3 or top 5 best options for you readily available in my view. And I can offer those to you before I ever have to continue to search. I do think that, like I said earlier, making this an ease of use for that frontline scheduler is really where we see our biggest successes.
That's right. That's actually, it's interesting that you say that. I think it parlays into something. I'm going to break from currently deployed stuff at Erlanger and talk about one thing that I think, Misti, we both spoke about, that you all are excited and we're working together to bring to your independent clinics. And so that ease of use is really important, especially when offices have choice. And I think at Erlanger, as many of our partners, that relationship with the affiliate provider and winning that affiliated provider's business and aligning to them and getting a competitive advantage to have them book is really critical. And a lot of that comes down to where's easier to book. And one of the things that Dennis had heard early on was it's hard for a clinic provider, affiliated provider, when that clinic scheduler has to go outside of their native interface, their clinical EHR, NextGen, Greenway, Athena, eClinicalWorks, and then go in through a portal from some other one, whether it be CareLink or something else, in order to be able to book a case or find a time. and then do the double documentation that's required from the clinical EHR into the hospital's EHR. And so Qventus created a way to change that, and then we're working together to bring that to you. But Alex, maybe just show that really quickly and a little bit about what we've done with customers there to make this process save on average about 5 to 7 minutes per individual booking for those clinic schedulers, and made it more of the default path for partners that we work with.
Coming off mute. Yeah, let me pull that up. So what we've done is actually embed this application within the clinic EHR. And that has allowed there to be, we can pull in a greater amount of data to auto-populate the form directly from that record. And we've also been able to really streamline that process. So now instead of clicking into a separate browser window or something similar, you have it all within their existing workflow. It goes right alongside the patient flow within the system. So when that clinic scheduler is looking to book either within Epic, within their clinic EHR, Qventus is right there with them. And by pulling in that data, we can help accelerate filling out that form and just removing additional friction points. And we've seen, lots of minutes being saved with that.
Alex, do you have that available to show real quick what that looks like? Or maybe let me give you a second to pull that up, and then I'll just maybe while you do that, Misti, would you mind just sharing like why does that matter? Why is that something that you're excited to bring to Erlanger? Did I lose you there, Misti?
So as with anything, and I just keep going back to this, you're talking specifically about the integration with some of these outlying areas.
Yeah. We're talking about the integration with the affiliated clinics. Like why would that be something that you're excited about us bringing to Erlanger?
Yes, just because we can have some engagement and early adoption. And so if you have an extra screen or an extra click or an extra 5 clicks, a lot of times you're not going to have the commitment from the end user to be able to really show the value of the product, because they're going to say it's too hard to do. I'm sure it's great, but I don't have time to even engage right now. And so eliminating some of those barriers, some of those steps and clicks, and showing that it truly does talk and brings over some of that manual work that's being done where they can feel it. It's palpable. I just saved some time with this booking. Look how easy that was. That's how you can have some true engagement on other fronts.
Yeah, that makes sense.
And like you said, they have a choice. We have a large group in town here, multi-specialty group. I think they have 25 or 26 surgeons in their group. And 80% of them, I believe, are exclusively practicing at Erlanger, and they have a choice, and they have service lines that could certainly go to some of our competitors, and they choose to be here. And that could change tomorrow if we don't continue to evolve and make this their desired place to work.
Yeah, thank you, Misti, for that comment. And it's a really slick integration. It's phenomenal actually to see when it's just a one-click download. It takes 10 seconds to download essentially a Chrome plugin, and it overlays on top of their clinical EHR. It makes it so much easier for them to see our partners' available time. But I think since we're running out of time, I'll just pause and say, please follow up with us if you're interested to see that. Happy to walk you through a demo of that. There's also a couple other things that, for the sake of time, we may not be able to get to, but I just wanted to touch on briefly. I think some of the work that we collaborated with you on, Misti, in robotics, and then also in helping to drive outpatient volume and align cases to the right site of care has been really helpful. Don't have a lot of time to talk about that today, but that's been, I think, fair to say some of the areas that have added a lot of value to Erlanger. If I can take the screen back, Alex, I'll just move on to our last section, and then open up for questions as well from the audience. There's a couple other things that we can talk about here, but for the audience, just to know, I think Misti's a great resource to ask about, like, how did we actually make this happen? Like many of our partners, Misti had to bring this in a thoughtful way to figure out, how do I get IT prioritization? How do I get IT buy-in to do this? How do I actually go about driving user adoption that's required in order to create the transformation? And how do you communicate the value to the frontline staff, to the providers that are going to use the system? So maybe just a couple of seconds on that, Misty, and then if there's other questions, we can answer them.
Yeah, absolutely. And I think that's probably going to be the question on a lot of the surgical leadership or administrators that may be on this call or viewing this webinar later is, how do I get it across the finish line? How do I get IT governance to approve an AI solution? How can I afford it? How can I truly show the value of this versus any other product that is presented? And I will say that I had a lot of those same questions myself. I was very leery. I always say heavy is the crown. If it works out, Misty was a superstar. If it doesn't work out, Misty just wasted money. And so I was very very specific in my ask. I encourage you to do the same thing. Don't just say, oh, this is a cool new widget, I can't wait for it to do my work for me. Be very specific in what you need it to do. Start with your baseline data and set your goals. You either meet them or you don't, and you have to track them along the way. Most importantly, you have to keep a product like this that sometimes can have skepticism around it. You have to keep it in the forefront. It's on every agenda, every steering agenda. There's a Cuventus update every single month in all of my departments. On my overarching OR committee, I have a Cuventus update, and it truly shows the value. And sometimes it's more than others, but there's always a positive value every single month that I present it. And that's how you can show specific examples to surgeon X or Y that says, remember, I did this for you. And then they can see that it's actually working, and it's not things that we would have accomplished without Cuventus. We would have grown those cases anyway because we hired that surgeon, or we would have improved that utilization anyway because you got stricter on your OR committee. You have to truly show continued value in partnership with any big solution, Cuventus not being unique.
Yeah. Eric, are there any questions that we can answer for the audience here in the next minute? Otherwise, there's more that I would touch on in this space for Misty.
Yes, we do have one question that I think would be great for you to answer. This is a multi-part question. So It starts with, which EHRs does Cuventus integrate with? And what does the system look like? Does it add feedback to Epic, or is it a web-based system to log in for recommendations?
Yeah, it's a really good question. So as far as which EHRs that we work with, on the ambulatory side, the primary ones that we work with are Epic, Cerner, Allscripts, and Meditech. And so we've kind of covered the basis on the primary ambulatory EHRs. On the clinic side, it's about 18 EHRs that we can directly integrate with. So your affiliated providers that are on Athena, NextGen, Greenway, eClinicalWorks, and the litany goes on of others, we have a set integration across all of those. So we have pretty expansive ability on the integration side. As far as embedding, we want to reduce any swivel time. It is important for us, and has been from the very beginning, to be maximally embedded inside of Epic, because Epic is the standard place for work being done across the EHR. And so we do that in a number of different ways. So for instance, when a clinic books a case through Cuventus, through TimeFinder, let's say, or through the affiliated offices, we actually do the work to write that information back into Epic automatically. So it just pops up in the depot, and we remove the OR schedulers having to go back and forth between two screens to document. Additionally, we try and meet the users where they are. In some cases, like in the affiliated groups, that's not in Epic natively. It's in their clinical EHR, so they're trying to meet them there. For the employed surgeons, we want to meet them inside their own EHR. And so we have done different things and different approaches for this. One-click launches, and right now exploring a way to actually do that directly through the case entry to open up a modal to make it even easier for them. So our focus is always on maximally embedding inside of Epic, and we think it's really important in order to keep the teams from operating from anywhere outside of their native workflow. Thank you. That's a good question. What was there any other part to that question that I didn't answer?
Nope, you've got it all. So unfortunately, we are out of time, but just thank you again, Dr. Atushro and Misty, for being here. Thank you to Alex for that demo. This has been such a great discussion. And we also want to say a special thank you to Cuventus for sponsoring today's webinar. And to everyone who joined, thank you for being here. We hope you have a wonderful rest of your day.
Thanks, everyone. Thank you, Misty.